I think digital health and care now means that this is about delivery. So it's how people can use digital to enable delivery of some of their key services and supports. So I think we're moving from it being an idea and a project that's maybe sitting in a digital sort of team space to actually becoming much more integrated into the way people are thinking and working. And also, from a citizen's perspective, I think the expectation that we will be using digital as part of the way we deliver health and care services. The major challenges probably are still the challenges that we had a year or so ago. So I think they're challenges to do with culture. So it's not so much about the technology, it's about the culture of the way people are working and how they can work in a different way. So I think that's an issue about how we take the workforce with us and support the workforce. I think there are challenges probably around service transformation, and I think I've used this analogy before, how you fly the plane while you're re-engineering the plane. So people are trying to get their heads up to say we want to do things differently, but we still have to do the job we were doing yesterday. Finance, yeah, probably still a degree of a challenge. How do people look at disinvesting from the old way of doing things to investing in the new way of doing things, because there's probably not going to be a lot of new money. And I think still a challenge on our engagement with the public. I think they have expectations, or we have expectations as citizens about digital, but I don't think we necessarily get that message across to the public in a way that we should be around new ways of working and support. We all need to be involved in driving forward this agenda. So I think it's not just a role for people who have digital in their title. And I think that for me is the big shift. So we need to ensure that as part of everybody's role, everybody's job, that digital is seen as being an enabler to how they can do that job, how they can support people. So it involves all sectors. So I know it's about how we get health services delivered, but it's very much, I think, around the citizen and how the housing sector is involved, how our care sector is involved, how our health sector is involved, and how other organisations, can support third sector organisations in particular and support that. Because I think there's so many takeaways. But for me, what I've taken away so far, I think, is this is about people, not about technology. And we need to walk the talk. So we need to do co-design as well as talk about co-design and build on that, I think, going forward.